Hey, welcome back everybody to Memphis Medical Society's Meet the Candidates interviews. I'm Clint Cummins, CEO of Memphis Medical Society. I'm joined today by Dr. George Woodbury, the Medical Society's legislative chairman and a dermatologist here locally. And our special guest today is a Democratic candidate for District 83, Jerri Green. Jerri, welcome.
Thank you. I appreciate you taking some time to speak with me.
Yeah, thanks for joining us. We're going to get right to the questions and get you out of here as soon as we can. So Jerri, the first question is, back this summer, Governor Lee issued Executive Order number 15. Among the provisions in that order include the ability for nurse practitioners to practice with autonomy. What's your position on the expansion of scope of practice for professions like nurse practitioners and physician assistants?
It's funny, when you first sent me these questions, my husband's best friend was in town, and he's acute care nurse practitioner at Johns Hopkins, and his brother is also a surgical tech, and his father was the chief medical officer at the hospital in Tupelo for decades. So he has seen it both from the doctor side and from the nurse practitioner side. So I said, hey, these guys are asking me this question, and I want to hear from somebody who's in the field and knows what it is. And our discussion involved around two main things. And one was how the pandemic has really reframed so many things in our society. And the other was patient care, right? So thinking about those two things, of course, doctors have more training, more education. Look, I'm an attorney, and I wouldn't want my paralegal going in and trying a death penalty case, right? There are different levels of training. That being said, there is definitely a place for them, and you want that support, you need that support so that you can focus on the more serious cases, in my opinion, and that serves the patient better. There are things that are going on right now that we need to make sure that our patients are covered. So if it's a rural area, not like District 83 where we have lots of wonderful doctors, lots of wonderful hospitals, maybe nurse practitioners, all they've got out there. And we need to make sure that the patients are getting served. But here in District 83, we have lots of wonderful physicians and lots of wonderful hospitals. And so I want people to get the best care possible. That being said, I do think there is definitely a place for people like my husband's best friend, who is a talented and wonderfully intelligent person and great bedside manner to help serve patients better. So I see their role as easing the burdens on doctors. Let me give you an example in my own life this year. In the middle of a pandemic, evidently I was not clear enough. I have 3 children. Many times I have said, don't do that, stop doing that. We cannot go to a hospital in the middle of a pandemic. I ended up in the hospital twice in the middle of this pandemic. Both of my sons, my oldest who is 10 and my youngest who is 3, ended up getting stitches near their eyes. One of them right here and one of them right here. 2 stitches, 5 stitches. My older son who got the 2 stitches, a nurse put in his stitches. My younger son who was 3 that got 5 stitches here, a doctor put in his stitches. Do you know what I cared about? I cared about my baby. I cared about my child getting the best care possible. And it did not matter to me in that moment as a mother who was putting in those stitches. I just wanted my child to get the care they needed, to get their wound taken care of, to be seen, and to get out of the hospital as fast as possible. So that's where I come at from this issue. I do want you to know that I am an attorney, and so I do like to examine issues in depth, and I want to hear from your membership about why this is such an important issue for you and how you feel about it, because you have the firsthand knowledge. For many years, when I left Georgetown Law School, I was a public defender. And so when people ask me about issues around criminal law, I have a vast knowledge of it because I saw a huge amount of cases up front and personal for many years being an advocate. I can speak on that issue. You guys will have to talk to me about what concerns you and what you see. But what I will tell you is my focus will always be on getting our patients throughout the state, including in District 83, the best care they can.
Okay. We're going to keep rolling with the questions. So throughout the pandemic, a lot of difficult decisions being made today that force business owners, parents like yourself, policymakers, and really everybody to balance personal physical health and even community health with economic health and that desire to get back to business as we hear so often. Can you talk about your thought process when you're faced with those kinds of challenges if you're elected?
Well, as I've mentioned, I'm a lawyer, and so I believe in relying on facts. I'm also a mother, and so I care about the well being of my children and others. My mother personally has rheumatoid arthritis and takes immunosuppressing drugs. And so it matters to me not only how people in my household act, but how other people act. And I'm just a firm believer that we need to listen to doctors, to scientists, to the data, to the facts. Right now, we are seeing a lack of action lead to higher hospitalization rates, higher infection rates, higher death rates in Tennessee. Right now, as we're speaking, we're about to hit the highest all time. And I think that comes from a void of leadership. Look, I want everybody to get back to work, to get back to playing football, to whatever it is that we enjoyed on life on the other side. But we can't enjoy our livelihoods if we're not alive. And that's just the bottom line for me. So I will always put our community health at the forefront. I think for many generations now, we have not been asked as a society to get together and to sacrifice as a whole, maybe not since World War II with, Russians and Liberty Gardens and things like that. And we have a strong sense of individualism in our country, in our history of, you take care of you and you pull up yourself by your bootstraps and individual success. And that's all fine. But we need to understand, and I hope we do, I hope this is the silver lining of this pandemic, is how interconnected we all are. And so while we're trying to get to the other side to restore our freedoms, we have to put public health first.
All right. So speaking of kind of challenges we're going to be faced with, inevitably our state's going to face some economic challenges because of COVID, mostly revenue decreases. When you're faced with that situation of inevitable cuts, how do you prioritize those, and would you cut healthcare spending?
I think it would be unconscionable at this moment to cut healthcare spending in the middle of a pandemic. There are ways that we can bring money in right now. We could start by bringing in the federal tax dollars that are waiting there for us to help make healthcare affordable and accessible to more Tennesseans, that we're leaving millions and millions on the table. There are also wasteful programs that we have right now that can be cut. Let me give you one example. The Tennessee Achievement Districts in our education system has, over the years, cost the state billions of dollars. It is being called to be ended, but we're not ending it immediately. And there's no date set. We've already decided this is a program that is wasteful and that is failing our students, but we're continuing to put tax dollars into it. We also continue to fight legislation, pass laws that are unconstitutional, and then once they're held unconstitutional by one level of court, we continue to fight it up and up again. That costs your tax dollars and my tax dollars. That's wasteful in my opinion. I'm an attorney. I'm not going to be passing laws that are unconstitutional, and I'm certainly not going to be asking you to spend your tax dollars for me to fight them in court in hopes that they get overturned. So there are millions of dollars in our budget that we can put back into other programs. I'm not sure we have to make cuts. We have a rainy day fund that is in the billions of dollars. It's pouring. It's Noah's Ark out there right now. Now is when we tap into that rainy day fund. So I am hopeful that with cutting out wasteful programs and adding in tax dollars from the federal government that are waiting there for us, we wouldn't have to touch any healthcare dollars. And that would certainly never be my priority in the middle of a global pandemic.
Okay. So those are all our questions, Jerri. We've left some time here at the end. If you want to talk about any other issues that we haven't talked about or expand on anything, here's a couple minutes for you to say what's on your mind.
I just would like to tell you guys, I am an attorney. I'm an advocate for people who normally don't have a voice or don't have their voice heard. I am an activist. I've been long involved with passing gun sense legislation because I've been a gun violence survivor 3 times over. And I know that that's an issue for many doctors around. I know there was a whole campaign, "This is our lane," because you are the ones that have to deal with that on the other side. And I'm ready to partner with people to try to enact legislation so less people end up in your hospitals. But above everything else, as I've mentioned before today, I'm a mother and I am deeply invested in this community and in this state because I have 3 children Those are my legacy when I leave this earth. I live here, I work here, I'm from Memphis, my home is here, my children are in school here. I want to see this place survive and thrive through this pandemic and beyond. And so I would love to have your support. I would love to work with Dr. Woodbury and others when we get to the Capitol to see what we can do, not just in the healthcare arena, but in other places, whether it is education or the environment, to make sure that we are leaving Tennessee better than it is today.
All right, Jerri, that sounds good. Thanks so much for joining us today and spending some of your day with us. Dr. Woodbury, thank you for joining us. Jerri, good luck to you on the campaign trail, and maybe we'll see you down the road.
The Zoom trail, yes.
Yeah, the Zoom
Thanks
trail.
for your time.
Thank you.
Take care, Jerri.